Welcome to Let's Talk About Cancer, the podcast that brings you essential insights into oncology. I'm your host, and today we have the privilege of having Dr. Satish C, a distinguished surgical oncologist, to discuss thyroid cancer symptoms, diagnosis, and preventive measures. Welcome, Dr. Satish.
Thank you. It's a pleasure to be here to discuss this topic.
Let's dive right into our first question. Dr. Satish, what are the common symptoms of thyroid cancer that individuals should be aware of, and when should they seek medical attention?
Commonest symptoms include neck lumps, especially in the center of the neck in the lower part, or nodules. Sometimes it may be associated with some mild change in the voice, some difficulty in swallowing, some sound while breathing. These are slightly rare symptoms. Common symptoms are usually a new lump which is seen in the lower part of the neck. If someone experiences these symptoms, especially if they persist for more than a few weeks, it is very important to consult a healthcare professional for evaluation, ideally a surgeon or a surgical oncologist.
Thank you for highlighting those symptoms. Our second question is, could you explain the diagnostic process for thyroid cancer, including the role of imaging, biopsy, and other tests?
Certainly. So diagnosis typically involves imaging like an ultrasound, a simple ultrasound, but with a qualified person who is able to give a TIRADS scoring. That is very important, followed by a ultrasound guided FNAC, because the success rate of a good quality FNAC is determined if it is ultrasound guided only. So these two are the core to the diagnosis of a thyroid cancer. Additional tests such as a thyroid function test, a CT scan may help determine the extent of the cancer and then guide the treatment decisions.
That's valuable information. Our final question is, what preventive measures can individuals take to reduce their risk of thyroid cancer, especially for those with a family history or other risk factors?
While we can't always prevent thyroid cancer, maintaining a healthy lifestyle, avoiding exposure to radiation when possible, and discussing family history with a healthcare provider are important preventive measures. Regular checkups and screenings can aid in early detection, which can improve outcomes.
Thank you, Dr. Satish C, for shedding light on thyroid cancer symptoms, diagnosis, and prevention. We greatly appreciate your expertise on Let's Talk About Cancer.
My pleasure. It's essential to raise awareness and provide information to empower individuals in their healthcare journey. Good day.